For the baby of the high-risk mother, the journey from womb to delivery room is filled with uncertainty.
Why is she not crying? He's right there. Push. Push.
Fraught with peril.
Push. Come on.
I can't.
And requires both patience and sacrifice.
Just keep thinking, I have God with me, and I'm doing this for my baby girl.
For the fathers and mothers.
It's tears of joy, but then there's tears of sadness because something could go wrong.
I'm so scared.
And doctors and nurses.
I can't believe that's my baby.
These are special deliveries. In the eye of the storm. At the University of New Mexico Health Sciences Center's High Risk Unit.
Tell me what you understand about what's going on and what's supposed to happen from here on out.
I don't really know nothing. I know I'm going to have an epidural and a C-section.
Okay.
23-year-old Desiree Sanchez is 34 weeks pregnant with twin girls.
They said she'll be good enough to come out at 34 weeks.
But she's only going to have one baby.
And it's true that survival for 34-weekers is just about as good as if they're full-term. Okay.
At 27 weeks, an ultrasound showed that baby A had died in utero.
The doctors found no reason why the baby passed away. There's no signs of nothing. They can't tell. But they're going to give her an autopsy when she's born.
34-weekers, you know, spend on average 2 weeks in the intensive care nursery, okay?
So far, baby B seems healthy. But doctors are concerned that some of her blood is being pumped into her dead sister, reducing the oxygen to her brain.
There's probably a 30% or 35% chance in a situation like this that the surviving co-twin will have neurological problems.
Yeah, let's go get some air.
The surviving twin is also susceptible to anemia, which could result in heart failure. It's almost too much for this young mother to bear.
I wanted to go home and cut her out myself and see what I can do for her. I tried to bargain with God, and I know you're not supposed to do that, but I did.
Doctors don't want to deliver the twins until they are sure that baby B's lungs are developed. But as long as she is shunting blood to her twin, her chances of surviving in the womb diminish daily.
If we can save the baby a week or two in the NICU, you know, for respiratory support, then I think that that's important.
Tomorrow, Desiree will undergo an ultrasound and amnio to see if her baby is ready to deliver. If so, Desiree is prepared for the best and the worst.
I just feel like my heart's torn in half. I don't know how I'm supposed to be happy. I'm gonna have to grieve. I just thought I'm still gonna be happy for this baby, but we're gonna have a baby 1 week and a funeral the next week. It's pretty tough.
The big day has finally arrived for Jane Garcia.
She's scared.
After 20 years of marriage, she's about to become a mother for the very first time.
Just want to get it over with, really. I'm tired. I'm ready to see my boy.
This is what I was looking for.
But it won't be easy.
Miss Garcia is a 42-year-old. This is her first pregnancy. She's advanced maternal age, which is a risk factor.
To complicate matters even more, Jane's baby is breech, or bottom first.
He's a little underweight. My water's kind of low. So the doctors decided to have a C-section.
If you needed a life-saving blood transfusion, would you accept one?
Because of Jane's age, there is also a 1 in 42 chance of having a baby with genetic abnormalities, including Down syndrome.
It's a happy time. It's tears of joy, but then there's tears of sadness because something could go wrong.
We're gonna go this way.
This pregnancy has been an emotional roller coaster for Jane and her husband, Rick.
I'm not used to seeing my wife, Jane, like, you know, with IVs and all these doctors. She gets really tired. It breaks my heart to see her have to go through something like that, you know?
As the Garcias prepare to welcome a new member into their family, the NICU team is standing by to make sure the transition into the outside world goes as smoothly as possible.
Gonna put you on the monitor here. Take a listen to the baby, doing what they call a non-stress test. Gonna monitor the baby for about 45 minutes.
Linley Quesada is 32 weeks pregnant, and she has spent a good part of that pregnancy in the hospital.
Okay.
It will be 7 weeks on Monday, and I've been here because I have premature rupture of my membranes.
The 29-year-old mother of two has only experienced uneventful pregnancies, but this third one keeps getting harder.
The baby's breached, so there's a possibility, since the premature rupture of my membranes, that the cord, the umbilical cord, might, you know, come out.
Feels okay?
Yes.
All right.
So I've been on bed rest because of that too.
People who rupture at 18 weeks are at high risk for going on, delivering a preterm baby, developing infection, developing trouble with the baby's lungs maturing.
When you feel baby's movement, push the top of that button for me, and I'll be back to check on you about 5 minutes.
Okay, sounds good.
Unfortunately, because of the ruptured membranes, Linley's amniotic fluid is very low. The fetus needs amniotic fluid to help with lung development. Also, those low fluids don't give the baby enough room to turn from a breech position to a normal birth position.
How's the baby doing, Linley?
Looks good.
I don't see any contractions. Good.
A C-section is inevitable,
Great.
but not for a while.
Nice strip.
Linley needs to reach the crucial 34-week point. Right now, Linley has to rely on her family for support because her husband is on military duty in Guatemala.
And he won't be back for about 2 weeks, which is not too long, but in that time is when the baby will be born. I just took my other 2 pregnancies for granted, and this one just, you know, just blew us away, you know, just one thing after another.
Sweet. So nice.
Can I have the mayos and pickups?
Whatever.
42-year-old Jane Garcia is about to become a mother for the very first time.
A few layers that they go through. Okay, they're getting close to where the baby is, okay?
To a baby who's 7 weeks premature.
What we're doing now is dissecting off the bladder. I'm in. Low pressure. One shoulder, the other shoulder. Hi. Can you put the table all the way down? There we go.
Baby Julian makes his debut, loud and clear.
He's looking good. He's crying. He's breathing well.
He has a lot of hair. I'm losing mine now. He has his.
And despite his small size of 4 pounds, 5 ounces, he needs little support.
So now he's staying pink pretty well without his oxygen.
But his mom is having a setback.
When we went to deliver the placenta, I initially just kind of pulled on the placenta. It wouldn't move at all. So I went in to manually remove the placenta, and I was unable to find a plane to remove the placenta. So what ended up happening is we think that she had a mild placenta accreta.
A placenta accreta is when the placenta grows into the wall of the uterus.
Another one, please.
It can cause severe bleeding.
Oh, we got something bleeding.
Doctors need to remove it as quickly as possible.
We were able to remove it by manually removing the placenta and then scraping the placenta out, and we were able to remove the placenta completely. Besides that unexpected complication, the rest of the procedure went very well, and she now has a healthy little baby.
And there's more good news.
That means he can go to the newborn nursery, the regular newborn nursery. And he doesn't need to go to the ICU. But he's just a little bit underweight.
After 20 years of marriage,
He's got your nose.
Yes, I know.
He's got your nose.
Rick and Jane Garcia finally have a family.
This is my son, Julian Allen Garcia. Happy birthday, Julian.
I feel like your heart is in there and I'm hearing you.
It's been 9 years since Bertha Gallegos' last pregnancy, but this time, Bertha is at high risk.
She's a type 2 diabetic, and during the pregnancy, she's required insulin to try and keep her blood sugars normal. Her baby on ultrasound actually looked pretty big, to at least about 9 pounds is what we're estimating.
Diabetic mothers can wreak havoc on their baby's systems. If a mom's sugar level rises, so does her baby's, causing an overproduction of insulin. Once the baby is born, its blood sugar will plummet.
The worst case scenario would be, severe hypoglycemia, which could lead to seizure. Same in someone else that that's hypoglycemic. They faint, they pass out, they can seize. And so you worry about that in the fetus as well.
I'm feeling excited, a little nervous, but I'm ready to have this baby.
I'm just afraid that something might happen to the baby or my wife.
So far, with the help of 4 insulin shots a day and this insulin drip, Bertha's blood sugar levels are normal. So doctors are focusing on the other problem at hand, a baby that may be too big.
Well, we're trying to deliver this baby because I'm 39 weeks along now. Baby is about 9 pounds. We're trying to get this baby out before it gets bigger.
Well, the shoulders can get impacted or stuck against the pubic bone, and you can have trouble trying to get the baby out. And what you do is you can pull on nerves that are in the neck, and they can get stretched and pulled. And the baby can have long-term neurological outcomes from that. Anywhere from mental retardation to learning disabilities to cerebral palsy to anything.
That's why doctors chose to induce Bertha today. They still think Bertha can deliver this child vaginally.
Oh, no, I can't.
But they know that at any time, it can turn into an emergency C-section. Desiree Sanchez is nearing the crucial day.
Been here too long.
But she's still in a balancing act.
The baby's growing well. She's high risk, and with a history of fetal demise of one of the twins, it puts this baby at higher risk of problems. And we got you 34 weeks and 3 days. Does that sound right?
Desiree can't give birth to her healthy twin until doctors can tell if it's developed enough. Each day, she undergoes non-invasive tests to determine if it's safer to keep the baby in the womb or to deliver it.
We are going to start from the top to the bottom, okay?
The Doppler will show doctors if the surviving baby is shunting too much blood to the dead twin, thereby hurting her own chances for survival.
So does everything look normal? Okay.
Everything's looking good. We have to get all the measurements, and then we can give you an estimated fetal weight.
Okay.
Make sure the baby's growing like it should. Do that one more time.
The Doppler and the ultrasound show that the baby is in no immediate danger thus far.
It's gonna be just fine.
Have you guys had one done? No.
No?
But you've seen it, huh?
I've seen it about 100 times.
The third part of today's procedure will tell if the baby's lungs are developed enough for a safe birth.
You know why are we doing this, right?
For the baby.
For the baby, for be sure the baby's gonna be mature when we take it out, okay?
It will be Desiree's first amniocentesis.
I'm just very nervous. Just keep thinking I have God with me, and I'm doing this for my baby girl. Make sure she's okay. And I'm very scared of needles, but it's something that has to be done. Okay, I love you, baby girl. I'm doing this for you. We have Destiny and Desiree. Destiny passed away, so we're just trying to do whatever we can to help Desiree.
Yeah, I'll just switch over to the glass.
In 24 hours, Desiree will know if it's safe to give birth or safer to wait.
Okay.
The wait is over for Lindley Quesada.
Getting excited?
Yes.
At 34 weeks, she's been scheduled for a C-section.
She has jewelry.
Once you get to 34 weeks, even though the baby's still premature, we feel it's safer to deliver the baby rather than take the risk of an infection occurring after 34 weeks. Good, so we're down to uterus here. The premature babies that get infection have increased chance of cerebral palsy and neurological problems. Delivering bottoms first. Good. We're fine. Congratulations.
Oh, thank you. Had a lap.
Julian Quesada is a good size for 34 weeks. 5 pounds, 7 ounces. However, he's not breathing well.
He's a little blue. He's a little bit, he's not as pink as we'd like him to be.
And he needs to go to the NICU.
Hi, would you like to meet your son? Hi. Thank you.
Julian's birth may have been relatively easy, but his survival skills are about to be put to the test.
Ah!
26 hours after being induced, Bertha Gallegos finally begins laboring.
I thought it was gonna be faster because being my second baby, but it's taking a long time. Ya no puedo, mamita, ya no puedo.
Right now we have an internal monitor in place, and with the internal monitor we can measure exactly how adequate her contractions are, and that's a certain number range that we count. They're called Montevideo units, and every time I count them, they're getting adequate. She's had a couple periods of adequate, and adequate means that they're strong enough to make cervical change.
And they're strong enough to cause Bertha unbearable pain. There is good news.
So Bertha's doing pretty well right now. She's progressing. She's about 6 centimeters. She was having some more pain, so we called the anesthesiologist to come and put some more medication to her epidural. But hopefully she's gonna progress and go rather quickly. Baby's still pretty high up, which is concerning that the baby is a big baby.
Bertha's baby is large, probably the result of her mother's diabetes. That could lead to irreparable damage.
If it takes a while to get the baby out, the baby can become hypoxic or have a low oxygen level and can have, neurological outcomes from that as well.
With so much at stake, the Gallegos family tries to keep Bertha calm and focused on what's becoming unbearably painful labor.
We got the results of the amnio, and your baby is not mature. So we need to come up with a plan right now.
Doctors want to wait another week and do a second amnio. But the invasive procedure can put stress on the baby.
How about my stress? I've been under a lot of stress just being here and worrying about the other baby. You know, I don't want to lose this one. And that's something that keeps going through my mind. But the other baby showed no distress, so how are we supposed to be at rest?
That's why we were doing this testing. That's why we were doing ultrasounds, checking the blood flow on your baby, making sure that your baby is doing fine. And if at any time we have found anything that will compromise your baby, your baby will be out. And so far, your baby is doing fine.
So how about if you do if you don't do another amnio? I mean, you think she could be better in a week? Her lungs, you think they'll be a little bit
Usually, that is what's happened. I mean, the more time the babies are in your uterus, inside you, the more time it gets the baby to mature and be ready to come out.
Do you think she'd be ready by next week, or you just don't know?
At 35 weeks, there's still a slight chance, much less than 34 weeks.
If she's delivered now, baby Desiree could suffer from more than just respiratory distress syndrome.
Another of the risks of prematurity will be that the baby can have bleeding inside the baby's head, and also they can have inflammation in the bowels that can lead to high mortality and morbidity for the babies, meaning that the baby can have increased risk for death and also associated infections and further complications after delivery. Anything that you need to know about what happened, about your condition, what happened with your baby?
I would like to know, but nobody's given me an answer, or nobody knows. Do you know what it could have been?
To be honest, no one knows, and we have suspicion of what will happen inside your uterus and to your babies, but we'll never know for sure until your babies are delivered.
All right.
According to the ultrasounds that were happening initially, remember that your babies have 2 sacs and 1 placenta, so they're sharing somehow blood circulation, and whenever that happens, one baby start giving all blood to the other baby slowly until that baby is compromised. And apparently that's what we think it happened. We will never know until delivery. When we take the placenta, we examine the placenta, we can find those blood vessels. If our suspicions are correct, when we deliver your baby, we will know that there is an anastomosis in the placenta, there was a twin-to-twin transfusion.
But without the amnio, there's no way to keep track of the baby's progress. Another one has been scheduled.
See if the baby's fluids will be ready in another week, hopefully. They could take her out then. If not, it'll be another week.
At 10 p.m. this evening, Margie Arriaga's water broke. Her husband barely had time to rush her to the hospital.
It happened so quick that I just told my husband, it's time, let's go to the hospital, and we just rushed over here, and I feel like pushing now.
A week overdue, she arrives in the ER 7 centimeters dilated. There's no time to wait for her doctor.
She was about to deliver in the resuscitation room down in the ER. So we got an OB team together, and we go down in case there's an emergency like this, and they need our help.
Medical staffers don't know her history, and they need to get her to an OB room as soon as possible, or her baby could be in all sorts of danger.
Our main concern when we're wheeling them up to the room is that they deliver without, you know, the proper equipment.
Within 20 minutes, Margie is almost complete.
I need a push.
Keep breathing.
There's no time for an epidural, but she has already decided on natural childbirth.
I'm gonna try to find Margie because she's supposed to be in labor right now.
I was shocked.
Do you know Margie's, which room is Margie? She's in room B. Go ahead and walk around through here.
That's it, Margie.
Girl, push, push, push,
That's
push,
it,
push.
Margie. Real intense.
Less than an hour ago, Margie Arriaga was rushed to the hospital.
Just curl up over your baby, hun.
By the time she arrived, she was almost fully dilated.
Okay, blow a little bit for me, Margie.
Blow a
okay?
little bit.
Staffers had to rush her from the ER to labor and delivery. And not a moment too soon.
Okay. Real intense, real intense.
Good. Squeeze it out, thank you.
Margie's amniotic fluid is filled with dangerous meconium, caused by a bowel movement in utero.
Okay, I want you to blow again while I suck the baby's nose and mouth.
If the baby inhales the meconium, she could end up with severe respiratory problems. It's crucial that the baby's nose and mouth are suctioned before she takes her first deep breath.
Why is she not crying?
Well, right now we want to get some of this stuff out of her throat before she gets too excited.
Girl. Congratulations.
Angeline Salinas weighs in at 7 pounds, 13 ounces.
She just had some stool in her water, but she's caught us by surprise there, but she's good.
And she already holds a prominent position in her new family.
My first daughter, yes. I have 5 boys.
And there will be stories to tell for years to come.
I just put my emergency lights on my car and I just came over here. I didn't want to come that fast either, though. So I just got here as fast as I could.
Everything came back so quick. Just having the baby right away, coming in, and I only spent like, 12 minutes in here.
And the big thing today is the weight check.
Julian Garcia has been visiting the newborn clinic every day since he was born premature and underweight.
My clothes on. Oh, yeah. Nice activity. Nice protest being disturbed.
But he's been passing all of his tests with flying colors, including the most important one.
He weighs 4 pounds and 1 ounce today, and he was 3 pounds, 14 ounces yesterday. So we're doing great. I am so glad to see that weight gain. The good news is you don't need to come back to see me. The bad news is I don't get to play with him tomorrow.
After today, he looks really good, and looks like he's on a good path right now. And we hope he stays that way. You know, and as long as Mama and me are here, he's gonna be okay.
Since his arrival in the NICU, baby Julian Quesada has gone from bad to worse.
The doctors say that the baby had a little bit of air between the wall from the lungs.
What we needed to do was to put a chest tube into the right side of his chest to evacuate all that air out of there so that his lung could expand again.
You see him okay?
Yes, I see him. He is very, very sick. And we're really worried that he has something called lung hypoplasia, or just small lungs. Get through.
It's even worse than doctors originally thought. Although born at 34 weeks, Julian has the lungs of a 28-week preemie.
And it's a spectrum. It can be just a little bit, or it can be so severe that some of the babies don't survive. He has been getting progressively sicker over the day.
The damage to his lungs is causing other problems, too.
The oxygen can get into the lungs, but not enough blood is flowing through the lungs to pick up the oxygen. You want to touch him and let him know you're here?
While Lindley bonds with her baby,
Hi, this is Dr. Savage. I'm one of the
her doctor is on the phone with Lindley's husband, who is far from home on a tour of duty in Guatemala.
I'm one of the baby doctors that's taking care of your son. And I've talked with Julian's mom and let her know how sick he is. He's on high-frequency ventilation. He's on lots of pressors, dope and dobutamine to keep his blood pressure up. He had a big pneumothorax, and we've got a chest tube in. That might be able to come out in a few days. I'm hopeful that we'll be able to pull him through. I think, through the weekend, if he can pull through, he should be okay.
Yesterday, a second amnio revealed that Desiree's surviving twin was still not mature enough to deliver.
I'm going to the 3rd floor for more monitoring.
But it's a moot point, because today Desiree has started contractions.
So we'll get to see if we'll have a baby tonight. I don't know. I'm hoping. A lot of people aren't, but I'm hoping. Oh. My back hurts so bad.
If you could give it a number from 0 to 10, what would you give it? Like 10 being a lot of pain, and 0
Every
being
time it
nothing?
happens, it's about a 7.
Okay.
They're pretty strong.
Pretty painful.
Yes.
Okay, take a deep breath in.
An earlier Doppler test showed that baby Desiree is still showing signs of anemia. Rather than stop the contractions and risk the anemia turning into heart failure, doctors have scheduled a C-section.
Desiree, I just talked with both Dr. Leslie, who's our attending today, and anesthesia, and they think we can actually go with your C-section around 9 o'clock.
Okay.
In about 20 minutes.
20 minutes? Oh, crap. Okay. Okay, I can't believe I wanted this so bad. Now I'm so scared.
Yeah, that's normal. All right, I'm gonna go get that consent form.
In cases like this, doctors are highly sensitive to the ramifications of delivering a live baby and a stillborn.
I want my baby already.
We usually ask if they want to see the baby, and depending on kind of what it looks like, we also kind of prepare them that maybe you don't want to look at the baby.
Yeah, I know. Scared.
Oh, really scared.
Did you want to see Destiny?
Desiree has already made her decision.
I want to see her when they take her out. I mean, I don't care how she looks. I need to know that they're right. I need that for my peace of mind.
You can hold her and spend as much time as you want with her.
Oh, I'm shaking her bad. Oh.
8 weeks of anguish are about to come to an end. In the next hour, Desiree Sanchez hopes she will be able to finally welcome one special delivery into the world as she says goodbye to another.
Just my cold hands.
I'm nervous.
Desiree Sanchez is finally going to deliver.
We like it. Okay.
Although her most recent amnio showed that her surviving twin still had immature lungs, Desiree just started contracting, and doctors have chosen not to stop her contractions because her living twin could be dying.
I need to ask you once again. Do you want to see the baby? There's gonna be a marked difference between both babies. Are you prepared for that?
I want to see. I need to see.
It's not gonna be a pretty picture, but she wants to see the baby.
I'm so scared.
Doctors want to deliver baby Desiree first. They feel it's important for the mother to hear her living baby cry as soon as possible.
Which baby is coming out first?
Living.
We try to get that.
Hi, little one. Oh, I can't believe that's my baby.
There's a look at the membrane there. Yeah.
Once the placenta is delivered, doctors try to find out what caused baby A to die. Right away, they can see that the babies were identical twins.
We cannot tell for sure if that was a twin-to-twin transfusion or if there was what we call a cord accident.
Only pathology and an autopsy of baby Destiny will confirm the cause of death.
Girl?
Despite initial fears that baby Desiree could be anemic or suffer neurological difficulties, during the first few minutes of birth, she looks extremely healthy.
I'm gonna take her to see Mom and Dad.
That sure is cute.
It's a bittersweet moment.
Oh.
But there's good news for Desiree and Dennis.
The baby gets to stay with you. It doesn't have to go to the newborn ICU. She's healthy enough to where she can go to the regular nursery.
Thank you, Jesus.
Today, Desiree will celebrate little Desiree's birth.
2 special babies.
A lot of hair.
Keep one and share one.
And tomorrow, she'll mourn Destiny's death.
Okay.
Thank you. Thank you.
Yesterday, after learning that his newborn baby may die, Enrique Quesada asked the Air Force National Reserve for permission to travel from Guatemala to be by his wife's side. It was granted immediately. He landed in Albuquerque moments ago.
Just tired, very tired.
It's a poignant introduction for the young father.
I had to not tell me something, but it's just that the emotion that was going through your head.
He's on a couple of medicines to kind of keep him a little bit sedated. They want to try to wake up a little bit more and stuff like that. But he's still going to have something for pain because he does have that chest tube on the side of him. Yeah.
Despite his son's condition, Enrique reacts to the new baby like any proud father.
You know, that's my son. I hope I will never have to see him like that again, you know. He'll grow stronger and go on, you know. Just to touch him, it feels so nice, just so neat. There's no words to explain that. All I can tell people is just to be patient and take day by day because it's hard on both sides, you know.
He's a strong baby and he'll make it.
Yeah.
Julian's got a long way to go. He needs to breathe on his own, and his lungs need to catch up to his age.
I'm gonna check to see if your cervix is completely dilated, okay?
It's almost midnight, and Bertha Gallegos has been in labor since early this morning.
It's still actually pretty thick over here on her right side. See how you do with this next contraction, okay? And push down in your bottom. Come on, Bertha. Push, 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 push.
4.
Because the baby's so big, the baby's head has to mold or kind of, the bones sort of go over each other to try and make it through her birth canal.
9, 10. Big breath and go again. 1,
Push
2,
down right here.
3, 4, 5, 6,
Push,
7,
push, push, push,
8,
push, push.
9, 10.
Those are good pushes. That was great. So your cervix still isn't completely dilated, but it's almost back.
But Bertha is in pain and exhausted, and her blood sugar is on the rise.
Big breath. Another big push with this contraction.
She's making progress. You want to have her push for about 2 hours before you call it a failure to progress.
Push.
So she was right at an hour. He's right there. Push, 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 push.
If Bertha doesn't deliver in the next 60 minutes, doctors will have to perform an emergency C-section.
I can't.
Yes, you
It
can.
hurts.
Yes, you can.
I got a son and I got a brand new baby girl that I gotta take care of. So I gotta try and get strong again and be a good mother to these two.
To help Desiree cope with her loss, her nurse has prepared a memory book for the deceased twin.
Oh my goodness.
It's a touching memento of a tragic situation.
Those are precious.
She was 11 inches long.
Oh, wow.
Can always wear it around your neck, as always remember her.
Thank you so much. I love this lady. She's so good to me. We'll miss you every day. God bless you, my baby girl. My destiny. I think I'm gonna be okay.
We can go.
Push, 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 push.
With her mother, her husband,
Oh, it hurts. It hurts a lot.
and her 9-year-old daughter looking on. Bertha Gallegos is into the second hour of pushing.
Push, push, push where it hurts. Push. Come on. Push, 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 push.
The baby is so big, her shoulder is stuck behind the pubic bone. It's an extremely dangerous situation, and doctors quickly employ a technique called the McRoberts maneuver.
We flex the mom's hips back towards her chest. We put pressure over her bladder to help disimpact the shoulder, and then we pulled down on the baby to reduce it from behind the pubic bone. So not only did she have a harder baby to push out, she had increased pain as a result of it.
Gloria a Dios. Gloria a Dios.
Here we go.
Gloria a Dios. Aleluya. Gracias, Señor bendito. Gracias.
Come see your little sister.
Lisbeth Gallegos is a big girl.
10 pounds, 3 ounces. Hi, baby. You're huge.
She's beautiful. I'm so happy. Felicidades, mamá. ¿Para qué lado? Hey. Hey. Au, au, au. Hija, mira.
The baby looked great. Baby was crying and pink and was breathing fine and looks okay.
But doctors won't know for sure until they check her blood sugar. Diabetes is hereditary, and there is a chance that her baby will inherit it.
¿Puedes sacarte?
Deja tu carita. She was overdue a week, like 9 days. She was past due. She was ready. She was full term. I just knew I had to come to 3rd floor and get ready to start pushing. I was being entertained in ER while they're taking my vital signs and all that, and I just wanted to come to 3rd floor and start pushing and have this baby.
After rushing to the hospital to give birth, Margie Arriaga can take her sweet time going home.
What's her name? Do you know her name? ¿Cómo se llama? Angelique.
And home means 5 boys and a new baby girl. Something this young mother will have to get used to.
I'm excited about her, just growing up with her and just having a girl around the house. It's gonna be different.
Yes, we're finally going home today.
Very excited.
After 2 long months.
Finally get to go home and finish my job being a mother. And go home with our new baby. We're glad she's doing well. The hardest part, we gotta leave Destiny. But everything will be okay. Our nurse will take good care of her. So we're glad for that. Just we finally had to say goodbye. And things don't always turn out the way you want them. We're still grateful, though. Get to go home with one. Take care of my destiny. I will. Give her a hug for me again. Bye. Thank you. We'll be seeing you. Thank you. Bye, everybody. I kind of feel like I'm leaving home. We're hopeful for the future, and everything's looking good. We will. Happy Mother's Day.
Julian's doctors are thrilled with his progress. In the past 24 hours, he's turned himself around.
His lungs have really improved. He's off the high-frequency ventilation that he was on when he was first born, and his lungs seem to be oxygenating a whole lot more. So that's really encouraging. That's really good news. But he's still pretty sick. We still think he has the lungs that are still too small, so they're going to have to grow quite a bit over the next few weeks. In the long run, he should do just fine.
The timing couldn't be better. Today, his mother has to leave the hospital.
It's been a long time here in the hospital. It's been 7 weeks. And I feel very happy to be able to go home and be with my kids again. Unfortunately, my baby, Julian, will be staying here. We're taking it day by day. God willing, he'll be home with us soon. I made it this far, and I'm not going to give up. I'm going to be there with him every day until he's able to get out of the hospital.
How are you? My name is Coral.
Before Lisbeth Gallegos can bond with her mother, she needs to take a very important test.
Anywhere between 40 and 120 is good. Okay. And as long as she maintains her sugar, then we don't have to worry about the diabetes transferring from mom to her. 73, you're good. It's an excellent sugar.
That's excellent news for Lisbeth's family, who still can't believe that she's finally here.
But I wasn't believing that she was 10 pounds and 3 ounces.
It was very worth it. And even, I felt a lot of pain, and, I was very afraid for a while. But if I had to go through everything just to see her little face, I would go through everything again.
Such are the sentiments of every mother who gives birth here at the University of New Mexico Health Sciences Center. No matter how big, how small, no matter how sick or how lucky, these special deliveries are life-changing, for better, for worse, for always.